begin with Mr. Bainey on this one. The question is, what would you have changed about how the health care bill that was passed and about future bills?
Well, we wouldn't have been discussing the health care bill from the very beginning. Now, I have read that bill, and it does have a bunch of scary stuff in it, but what has me all worked up is that literally it destroys the relationship between yourself and a physician. You no longer will be able to determine what kind of care you receive. That care will be determined by a bureaucratic board that will determine what your economic value is to society. It wouldn't even gotten to the point that it has gotten to today. That's one of the reasons I'm angry. I'm angry at those who shoved it down our throats. I'm angry at those who are supposed to have my family's back and allow it to get to this point. It should never have even gotten this far. It shouldn't even made it to the floor for a vote. The first time these kind of concepts were brought up, there should have been someone tugging on somebody's tie. And that's what I will do to change these kinds of bills.
Well, if I could only change one thing, I would change the mandate. The government is trying to mandate on states. As Governor Daniel pointed out, this mandate is going to cost billions of dollars to Hoosiers. It's going to raise our taxes. Today, this afternoon, there was something else discovered in the bill that's going to cost the state $400 million in addition to that. But more importantly, this bill shouldn't have been taken up. It is not the time to take it up. The problem facing us right now is an economic crisis. We need to get people back to work. We need to get employment moving again. We need this country on a sound fiscal basis. And how this administration could possibly say, we're going to set that aside and make that secondary, and we're going to push our liberal agenda through while we've got the votes in the Congress, is a disservice to America. It's a disgrace to America. We ought to be working on jobs and getting the economy going and doing other things later.
The approach to health care reform should have been much more limited, and it should have been limited to free market approach. For example, to allow individuals to purchase health insurance policies across state lines, to create tort reform, to eliminate the propensity of defensive medicine, to create alternatives to traditional health insurance, such as health marts or association health plans, to allow for greater access and lower per beneficiary costs for that access and for those insurance policies. There are reforms that should be made. There are ways that the government can get out of this process and allow for greater innovation. It is not a government takeover of the healthcare system that Congress has recently passed and the President signed into law. That's why, as part of the first obligation of a newly Republican-controlled United States Senate, we must begin to repeal provisions. We must begin to put bills in front of the President where he's called on to repeal and replace it with good policy.
First of all, I've signed on to the Club for Growth Repeal It pledge. I believe that this is the wrong bill for America. I think that the problem is really, it's not health insurance right now, it's the cost of medicine. And as John pointed out, there's things that this government should be focused on in getting back to free market principles, encouraging young people to go into medicine. I was just talking to a young lady down in Topala just recently, and she's having second thoughts about going into medicine because the government is going to dictate to her how much money she can make, when she can make it, how she's going to practice medicine, who she's going to practice medicine to. I've been to Haiti and I've been to Russia and I've seen communistic and socialistic medicine, and it is not right. It is immoral for us to allow our federal government to be able to take over our healthcare system through insurance first rather than addressing the real reason, and instead of regulating our healthcare system through mandates and forcing nurses to stand at nursing stations for 40% of their time filling out paperwork because of the government. As Ronald Reagan said, government is the problem.
That's right.
Emory, very quickly, there are three answers that I want to give you. First of all, the premise was wrong. Socialized medicine is the goal of the President of the United States. And if we do not repeal that bill, we are headed down that road, and we must repeal that bill. That's number one. Number two, free market principles, absolutely. You're going to get, hopefully, some repetition with my colleagues tonight. And so I don't want to repeat what they already said, but that's the place to start. Free market principles must always be the premise. But thirdly, I want to talk about tort reform. And for whatever reason, it's not resonating with Americans because I think most do not understand it. But one of my greatest concerns is Republicans were in charge for 12 years. It only took us 12 years to lose our way, and in the 12 years Republicans were in control, they did not pass medical malpractice reform, and they should have. So I believe America is going to give us another chance, but we dare not squander that opportunity.
Significant tort reform. And the fact is that the President of the United States at that time, Bill Clinton, had lunch with the American Trial Lawyers Association, and after lunch he walked directly to his office and placed his veto on tort reform. It needs to take place. It has been passed by Congress in the past. I wish we would have done it during a Republican president as well, but just to set the record straight, a Republican-controlled Congress has passed it, and we need to do it again. Thank you.
And a Republican-controlled Congress was in control from 2000 to 2006 when we had a Republican president. Why didn't they do it then? Why didn't they defund Planned Parenthood then? It's wonderful, ladies and gentlemen, for us to talk about all these grandiose things that we're going to do. But unfortunately, these are things that could have been done. And that's why America is looking for new leadership on Capitol Hill.